All right, tonight the Dayton City Commission will vote on an ordinance that will require face coverings in public spaces. We are taking this action in response to concerns raised by Public Health Dayton and Montgomery County and the Ohio Department of Health. They are concerned about the significant increase in COVID-19 cases in Southwest Ohio and specifically in Montgomery County. We have also heard the call from our business community, notably the Dayton Area Chamber of Commerce, to take decisive action to stop the spread of cases in our city so that our businesses can remain open and their employees can stay safe. The ordinance, which will go into effect on Friday morning at 8 a.m., will require people to cover their nose and mouth when inside public spaces or outside when not social distancing is not possible. Locations include grocery stores, retail stores, libraries, bars and restaurants, and public transportation. The intention of this ordinance is not to change the practices of businesses that do not directly serve the public. This is about reducing community spread as people move about our city. Violation of this ordinance could result in a civil penalty of $85. Enforcement will be conducted on a complaint basis by business owner or employees who are concerned about a member of the public not complying with the mask requirement while inside their location. Employees should first encourage the member of the public to wear a mask or leave the premises, and if they do not, they should call 937-333-2677, or the same number as 937-333-COPS, to report their concern. Dayton Police will follow up to investigate the complaint and potentially issue a citation. I want to be clear. We are not asking members of the public to confront or report one another. If you witness a person not wearing a mask inside of a business, please report this to a manager so that they can respond. We recognize that wearing a mask is not possible for all people or in every circumstance. Children under 6 years of age are not required to wear a mask. Neither are people with medical conditions, mental health conditions, or developmental disabilities which restrict or limit their ability to wear a mask. We are not asking the public to cover their nose and mouth when eating or drinking at a bar or restaurant. When outdoors, we are only asking the public to wear a mask when it is not possible to maintain physical distance from others who are not part of your household. This also does not apply where it is impracticable to wear a mask, like when swimming or receiving medical or dental treatment, or when inside a gym or a similar indoor facility where distance between guests can be maintained. We know that this is a tight turnaround for compliance for many of our local businesses and nonprofits. That is why we are working with RTA, the Downtown Dayton Partnership, and the United Way to distribute masks to business and community organizations that may need them for members of the public in the next few days. I know, including myself, that no one is excited about wearing a mask. I know that wearing a mask is uncomfortable. I know that, unfortunately, wearing a mask has become a political flashpoint. But I also know that masks save lives. Masks are incredibly effective in reducing the spread of this virus. Masks are a small sacrifice that we can all make to take care of one another and to keep our businesses open as we continue to weather this COVID storm. With that, I'm going to ask my favorite doctor in the region, or ever, frankly, Mickey Doan from Dayton Montgomery County Public Health.
So thank you, Mayor Whaley. I just wanted to review a couple of quick things to reiterate what the mayor said. Masks are effective, so is keeping our distance. And partly we know that because, as the governor had said, we used to have about, as it says here, just over 10 cases per day. That was our peak, okay? And that's when we started wearing masks, keeping our distance, and we didn't really see much change there. But recently, as things have opened up, we've now gotten up to 43 cases per day on average. And so it's 4 times higher. When we were wearing masks, when we were maintaining distance, we didn't have that. People have asked us how many cases are there Well, there's about nearly 1,800 total cases, but more importantly is how many people are actually sick today. And this shows that we had a peak before we started making the measures and the social distancing, of about 125 people who were sick on a given day. Now we're up to about 427 people who are sick as of yesterday, This isn't the total with people that have recovered. This is people that are sick at that point yesterday. And so we've got a significant increase there. And it's going to be changing a little bit because we don't actually know everybody that was sick yesterday because there's a little bit of delay in the reporting. So it may be well over 427 people that were sick. And so this is just the kind of information that has been helpful to say masks are effective and that we here in Dayton and Montgomery County are having a little bit of trouble with this. And it's time to take some actions and for all of us to think about what we're doing to try and protect our neighbors and ourselves. Thank you.
Thanks, Dr. Doan. All right. Before I take questions, I want to thank the law department and Barb Dosick, as well as my staff that have worked so quickly to get this together, and really appreciate the partnership we have with Dayton Montgomery County Public Health. There is really nothing in this issue with COVID that we do not look to Commissioner Cooper or Dr. Doan on, and it is their work and urging that makes us take action to keep people safe. Okay.
Why do you think this is the
Well, really what you saw when you saw Dr. Doan's increase and the concern that we were hearing about this community spread has just become a significant issue for us. And so that is the reason why. This is a decision that's based in data, and also it's a decision that's been based in what we know so much more about masks. I remember when Dr. Doan and I first started doing the doctor is in every other week, really the data said, oh, we don't know how effective these are just for somebody else. But now we know they're actually effective for ourselves too. So they do great work, not just protecting others, but just this regular mask protects you. So I think just the sheer amount of knowledge that we have around how much this can make a difference, and also the increase of community spread in our community, are the reasons why this action must take place in Dayton. Look, it's a complaint-based. I think that that's important. We're really encouraging people not, we know it's going to happen because of what we've gone through with the stay-at-home order. I'm sure we'll get lots of calls from people that want to turn in someone in the Kroger aisle next to them. We're encouraging them to go to the manager, to go to an employee. We don't think this is a gotcha kind of thing. What we're trying to do is really raise culture here and say, like, hey, this is what you have to do in Dayton to be a good citizen. You need to stop at stoplights. You need to wear shoes on your feet when you go into the grocery store. You need to wear shirts, and you need to wear a mask when you're in public. These are the things to be a good citizen in Dayton you need to do.
Mayor, what is the best way, aside from talking to a business, to report someone who might be known?
Again, if you're not an employee or a business owner, who we're encouraging them to call if they cannot get this figured out in their public spaces, we want you to turn, as a regular citizen, and you're in a public space that is inside, we want you to go to that business owner or business manager or that employee.
Does that mean they're calling public health? Or
No. Again, so you're in the Kroger's, someone's not wearing a mask. Find an employee at Kroger's. They will say, hey, you're supposed to wear a mask. We're not encouraging people to get in fights about this. And then we're encouraging businesses, should they have altercations, to call 333 cops.
This shall be indefinitely. I mean, when does the state executive order happen?
I don't think it does. So when the state executive order is over, or we magically find a cure, or not magically, if we find a cure quickly, we will definitely, nobody's enjoying this, so it's not like we'll be like, oh, still wear masks after COVID. Nobody's going to say that.
Mayor, when people are just outside, whether it's going downtown, if they can socially distance, they're okay without masks.
Correct.
But as soon as they can't,
Correct.
even when outside.
Even when outside, correct. We are not a super dense community. I walk my dog every morning. I don't ever run into anybody, right? So I'm not in any harm's way. When I went to the protest, I was right next to people. They need to wear masks.
Did you model this off of any other community?
Yeah, Mesa, Arizona. Is that right, Barb? Mesa, Arizona.
Why their model?
And others, right? Here, why don't you come up, Barb?
So in making,
Wait till you get there,
okay,
'cause
thank
you
you,
got a
dear.
mask
I got a
on.
mask on. Okay. In Barb Dosek, city attorney for the city of Dayton, in reviewing and making decisions around what our ordinance was going to look like, we looked at Mesa, Arizona, we looked at Michigan, we looked at North Carolina, we looked at Texas, we looked at other municipalities and state orders. And so we reviewed as much as we could to try to get the right fit and the right ordinance for Dayton, and that's how we got to where we got.
Have you received messages from community members that are in opposition to state
That's
government?
all
Have
you.
received some indication that they're not, that this could proceed and not so?
Why would you think that? Yes, we've actually, when we said, I think Saturday and Friday, Saturday, you all covered that we were considering it, we actually got a lot of positive response, and we have received lately a bit negative response. But I was actually surprised at the amount of positive response we received just from the consideration.
Did you, did any of the negative responses have things that you said, oh, that's reasonable, and you said this?
Not that I've seen. Like, the negative responses have been just angry about wearing a mask.
Mayor, do you believe that this will probably pass at next meeting?
Yeah, I've talked to each commissioner individually. They seem supportive. So they got the ordinance about an hour or two ago. So
How big of a problem is, how big of an issue is people not wearing masks? How much of a fluctuation do you think that's?
I think it's uncertain. It depends on where you are. You know, I think it's not as good as it was at the beginning. And I think that's what's concerning us. And it seems to be less and less as we continue on. And I think that's a concern. I think you all see that as well. I think some of you have told me that.
Some other, and I know you mentioned other places you model that, but, so are there not other Ohio communities that
I think Yellow Springs, Ohio, right? Yes, our friends in Yellow Springs.
Just for public health, are there any talks right now about having an ordinance like this countywide
Your
or in other
commissioners.
cities in the county?
So the question was, from a public health perspective, are there any concern or any options or plans regarding this type of ordinance or resolution for the rest of the county? Certainly, we support the leadership from the city of Dayton to move forward with this appropriate and necessary public health intervention. We're not in a pandemic globally because of, quote, surface contamination, et cetera, and then touching our face. Yes, the virus can transmit that way. We have a pandemic because individuals are not social distancing. The virus is spread person to person through respiratory droplet and respiratory aerosol, and we're not wearing face coverings. So we would encourage all jurisdictions within Montgomery County to follow suit, similar to the city of Dayton's ordinance, because we all have an obligation to protect each other.
just along that same line. So, it's obvious, but it doesn't stop the Dayton city supply. In other words, the virus doesn't stop just because Dayton has a mask ordinance, it doesn't stop at the city limits. So, what do you think chances are getting suburban communities on board?
I think we continue to share the data. We need to be making data-driven decisions. We need to continue to advocate for this statewide. You know, obviously the governor has highlighted 2 counties in this state as areas of concern, and he's told the entire state there are 2 counties that are areas of concern right now: Montgomery County and Hamilton County. And the reason we're an area of concern is because we have a significant increase in community spread. There's an easy way to address this. Let's keep our physical distance. And yes, as the mayor indicated, it might be a little uncomfortable, but we should all be willing to accept that to protect each other and wear a face covering. And we'll continue to advocate this with every other jurisdiction in Montgomery County to adopt a similar ordinance.
Josh, might I ask you a question about that?
Mike's not normally at our 4 o'clock.
That's then the peak was around the end of March.
But you said we were at about 10 and we're looking at 42 cases right now,
Yeah.
and you feel like there's about 4 times more sick individuals as well. How does that relate to your testing? With that, in other words, are you doing 4 times more testing? Are you doing 4
No.
times more testing? So it's not, can't be attributed to just testing.
No, this isn't just testing. I mean, that's not the case. I mean, we were testing people who were sick. Now we're testing lots of different people, obviously. And so the cases that we're seeing are real cases, they're new cases, and they're because of increased transmission. I think Dr. Fauci said, that there's 40,000 cases a day nationally, and he wouldn't be surprised if it goes up to 100,000. And he said the main driver is people are not maintaining distance and not wearing masks. And that's a very simple thing that the city of Dayton's trying to address at this point. And the severity that we're seeing, people seeking medical care is up. Okay, that's not just more testing, that's people who are sick and they're seeking medical care. The hospitals are seeing more people. They still have lots of, we're not close to overwhelming the hospitals, but they are seeing more. And all of these indicate that really, as might be expected, as people get out and circulate more, there's going to be more transmission. And we're not doing the things that we can individually to sort of interrupt that.
Is there any concerns about access to space? Well, I mean, is there places where people can pick these up that?
Yeah, so we recognize this is happening very quickly, so I really appreciate city staff that has distributed to the United Way, who will work with our nonprofits, to the partnership who's agreed to do all, local city businesses for us to distribute. And we've working with RTA and the library. We're concerned about people coming on buses, for example. And so we're working with our partners to provide masks. So when you go to a front of the build, like the whole thought is if you go into a public space, there will be masks right there so you can put one on that's disposable. We've distributed so far 45,000 masks to be prepared for this. The city has. We've used our CARES dollars to do that because we recognized that we wanted to help the community to be ready for this. And so we recognize we're doing this Friday morning at 8. Folks needed our help, and they've been really great in taking that and also helping to move it forward. I made a significant amount of calls about this to community leaders. I did not have a single community leader express concern to me about it, and I think most of them actually said thank you. So, any other questions?
What would be I know it's looking down the road, but what would be the numbers that you would say we can relax some mask enforcement, what would we have to see?
Well, I'll let public health talk about that. Listen, again, these decisions I make are based off of public health recommendations. So,
Sure, we'll double team this. So the question is, when will we have an indication, or what will be the indicator by which we would relax this, the city of Dayton would relax this requirement? Obviously, we're still learning about this pandemic virus. We still have an upward trend in this country, nationally, throughout the state of Ohio, in our county. So we're nowhere near done with the first wave of this pandemic. One of the indicators would be we would be making data-driven decisions. And so as we begin to no longer see increases in cases, no longer increases in hospitalizations, as well as we have a better sense of what the future looks like throughout this state and this country, that helps weigh in on any type of decision regarding what would be the end period for this type of resolution. But it's way too early to predict what that may be right now. Keep in mind that as we go through the next series of months throughout the summer, and as this virus continues to spread, then as a community we also need to prepare for seasonal influenza that's going to happen this fall. And that's going to place individuals, especially vulnerable individuals, at much greater risk as well, because we would have this coronavirus circulating plus the influenza virus. So at this point, it's a protective measure that we need to implement in Montgomery County. The city of Dayton is doing this first, to make sure that we protect our citizens. Dr. Down?
I think I put it in a larger perspective. I mean, one of the things that we know is that vaccine rates have dropped off for kids, okay? That may seem like it's kind of coming out of left field, but, you know, we need to see about getting those vaccine rates back up, and we need to do it over this summer with pediatricians and family practice and other people taking care of kids and public health, giving those vaccines so that kids are ready to start school. That is going to be a huge, huge variable in this whole thing. And I've said it before, I've said part of what we're trying to do is make sure we've got a safe environment so that kids can go back to school, so that we can protect those young kids from this virus, protect their parents and caregivers from this virus. And that's, I think all of that is going to mean there's not a specific number per se. It's going to depend on what the whole situation looks like. So as kids start back to school, the state may make different moves, I don't know. We don't know what's going to happen. And we're just going to have to watch and sort of play it as we go along. So that's not a great answer, but I think that's the honest answer. And it is, in fact, the kids that get me the worried the most.
You guys good?